Be more aware of your health status, health conditions, and enjoy healthy living. Choose to know more and listen to Health Unpacked every Thursday at 5:35 p.m. on High Voltage. Your health, your wealth. Brought to you by Tebelopele Wellness Clinics.
It is in a wonderful dial to my FM, more talk, more music, and I am with the beautiful Dr. Botlhale Mosadami. I do hope I said it correctly.
Yes.
You're so pretty, Doctor.
Oh my goodness, thank you.
You're so pretty. Welcome to the beautiful blue studio of Duma FM, and today we are talking, of course, Tebelopele Wellness Clinic. Gompieno moreetsi ha ile gone o tshubang sermomo wa sa gago o gorogile ka nako ebile o tshwere ba Tebelopele Wellness Clinic re bua ka premature ejaculation ka sore ha re premature ejaculation re ra go goroga pele ga nako goroga ka speed ha lo motshameko hema a re tsena hela mo go yone hela briefly define what premature ejaculation is ke tsa se re tsene mo go yone me o ka yatolosa.
Emma, thank you so much. So like you rightfully said, basically ka tswana hela re premature ejaculation re bua ka gota kana go goroga kgotsa go ntsha matute isi ne nako. So it's defined as a condition whereby you are not able to control the release of or ejaculation, and this it happens when you are not able to basically when you wish it for it to happen, it happens before. So it's a condition it affects men usually who are under the age of 40, and it is one of the most common sexual dysfunction disorders. A few weeks ago we talked about erectile dysfunction, and a lot of people confuse it because they interchange the two terms, but in erectile dysfunction, we're talking about not being able to fully erect. But then with premature ejaculation, we're talking about you're able to get it up, but you're not able. You release the sperms before you desire.
Now, when we look at premature ejaculation, what are some of the signs and the symptoms that you're listening right now and you just want to know maybe I finished the game too fast, so what are the signs and symptoms?
Okay, so I think when we look at the signs and symptoms, it's quite obvious you're not able to, you release the sperms before, So now I think it's more appropriate to talk about how we classify and what is normal. So for example, in medicine, we use systems to classify things. So for this condition, we use a criteria called the DSM criteria. So now when we classify premature ejaculation, for you to understand the signs and symptoms, you're talking about a pattern of ejaculating during partner. So there has to be a partner there. It should not be self-pleasure. And then it has to occur within 1 minute of you penetrating. Whichever direction you choose. And this occurs within 1 minute. And are redefined as mild, moderate, or severe. So highly mild, highly 1 minute, 30 seconds to 1 minute. Moderate is 15 seconds to 30 seconds. And then highly severe is where it occurs immediately after or within less than 15 seconds. And then it has to have been going on for at least 6 months. For me to diagnose you and you have premature ejaculation, you have to have before 1 minute, and it has to be going on for 6 months. And then the final thing is it has to cause a lot of stress, like significant distress to you as an individual. And then there's the fourth part of it, and they say that it shouldn't be due to other reasons such as we're going to talk about some of the causes, but it shouldn't be to other reasons such as medical or drugs or anything like that. Evaluate that. So those signs and symptoms premature ejaculation.
Now you just touched on medical being one of the reasons. You could be on drugs or a particular medication. What other causes or what other things can cause premature ejaculation?
So I'm going to classify this according to my locality, Botswana, what I have experienced in the clinic, there are a lot of causes, but I'm going to zoom into what affects Botswana men. Remember, this is a condition that affects men under the age of 40, as opposed to erectile dysfunction, which is older men. So now you're talking about boys as young as when they start the puberty process. So the most common thing I've seen is, number one, performance anxiety. Fear of failure to satisfy your partner. We worked hard to get here, and you have a lot of anxiety. How am I going to be able to manage? And anxiety Francistown. That's the most common thing I see. The second one is what we call conditioning responses. So for young boys who have been introduced to social media, video, movies we watch, and these young boys grow up knowing that watching a 1 hour movie and thinking that is what is supposed to be normal. So now they are conditioned to respond to think that that is what is supposed to be normal, and when they are unable to get there or unable to perform like they do in the movies, they have this frustration, and they end up having premature ejaculation. Or for other young boys, it's young boys who've had traumatic experiences. I think in the clinic we've seen some young men or even older men who said they were abused by their cousins, growing up from traumatic experiences, relationship problems that they saw their parents going through, and this dysfunction, they're not able to sustain because they've got traumatic experiences inside. And then of course we're talking things like substance abuse. So commonly, the third most common thing that I see is alcohol abuse. So people who take a lot of alcohol, they tend to not be able to perform, and that is very common in Botswana because alcohol is a source of entertainment. And then other things, things like anxiety, the financial worries, how am I going to be able to satisfy and economically and you end up also satisfy
Interesting. When men come to you, doctor, take us through the screening process. So just run us through the screening process.
Okay, so with Tebelopele, we always say it's a one-stop shop. So we always advise people to first come for an HIV test. That's the entry point. That's the thing that Tebelopele is known for. And because we are known for that, we've taken advantage to offer other services because we don't want to refer you anywhere else. You get everything honoho. So once you sit down with your counselor and they realize that you have certain problems, we do have our men's clinic. They refer you there, where then we do what we call taking a history. How long has it been since puberty, or this is something that has been happening recently, and then from there we classify you mild, moderate, or severe, and then I determine is it since puberty or is this something that is from there, I examine you, or the nurse examines you from head to toe, because there could be problems with maybe I know some men they only have one testicle, for example. So when we examine you and we realize some of these things, most men don't get sick until they're older. So we examine you and then we investigate you. We treat the underlying cause if there is an underlying cause, or we move further into the management. So it all starts with you doing an HIV test.
Now, premature ejaculation, is it something that is curable, or it's just a condition that you have and sorry buddy, that's just your life?
I think from the discussion that we've been having, Tata, I could say that mostly I'll say yes. But there are some of those rare cases that unfortunately it's not curable. But I would like to say I would move towards the side where it's curable and it's treatable.
And take us through the treatments that one can go through, or the counseling, or you spoke about trauma being one of the causes. You spoke about alcohol consumption. You didn't mention weight though.
Yes, definitely. Lifestyle.
Lifestyle also.
Lifestyle,
so take us through some of the ways we could treat or curb or
prevent.
Yes.
Okay, so one thing that you should understand about this condition. I get really go diagnose. I guess not go diagnose. Diagnose. First things first, I have to have a partner there, a female partner. Good, we need to sit down with your partner and encourage them and make them understand that this is a condition, because the first step to that is counseling. This counseling, it can be individual, it is also couples counseling. If I need to refer you to a psychologist or a psychiatrist, I do that. If we need to teach your partner, there are certain techniques that we teach your partner. Start and stop, squeeze and pause. How the clinicing more about how to do them with your partner.
I'm interested to find out what that is. Go back, doctor. You have to you can't say start and stop, squeeze and pause. We want to know, what is that?
Okay, so start and stop, or pause and squeeze and pause. It's one of the most common technique that sexual therapists use for couples with premature ejaculation. This is where I can remember like about 15 seconds, 30 seconds, but 1 minute. The thing is, kana pasile ya rona e dirwa ke di tshika tsa bosisi. So ha gona le yone that sensation ya reng matute tswa I cannot control. Bo start and stop is whereby we teach a partner house no na o tsena o bo o hateng o tshameka ha o se tsu utwa ikara a bata go tswa wa ya ma o bo tswa o bo o iphanako re na le gore ba opele pinanyana kana they think about something that is non related to that gore khona gore e boe mo gongwe ke bo pause and squeeze ke where your partner gets involved mo eleng gore ha se tsa tlhaloganya le ena ha bona gore wa ema a ba go thusa o tswala phasele go kgorong a be a ema. So it's a technique eleng gore e thusa banna to gain your strength. I get it, this thing is a muscle, it gets memory. The more you exercise it, the more it remembers. Wow. Mo gongwe sa bohelo se ne ke batla o bua ka sone ke dilo tse eleng gore di thusa monna go decrease yone sensation eo. Go na le di kausu tse di teng mo di pharmacy tsone tse di tetseng mo di line ka yone. There's a special cream called lignocaine e eleng gore e thusa monna gore go hokotsa bosisi. So so I usually recommend that for clients. They are called lignocaine filled condoms or benzocaine filled condoms, so we can prescribe that to you. And then finally ke dipilisi tota dipilisi ke ma pele ka tsone because there's really no proven drug that is approved, but as doctors we can use drugs sometimes that have other side effects, if you know what I mean. I'm sure the doctors out there listening know what I mean. So we use
I like the look that the doctor's giving me. I don't know what you mean, girl. I don't know.
So we can use antidepressants.
Yes,
antidepressants tse leng gore ra ditse rona bongaka di khona go thusa banna with this problem. Mary di togela go bohelong ga go setse anong dilo tse dingwe go padile like couples counseling le tse dingwe ya
moretsi ha ile gona o tshubang seromo mo ga ke tso rontso le ka e re bua ka premature ejaculation re la le yalo Dr. Botlhale Mosadame me re tsana ko phelletsong ya puisonyo ya rona. Ha moretsi a reditse o ka gakolla moretsi o reng ka re le ka go garela sotle se re se buileng o ga gakolla moretsi o reng e bile mo rotloetsa gore a tle go iponetsa gone ko Tebelopele a tle le tle go mothusa.
But I think for banna, I think we are now at a point where we realize we need male involvement more our reproductive health care system. Gantsi di kliniki tse patela di remeletsa thata mo bommeng. Me ano re lemogile gore manatsing a banna bana le mathata and ga bana go ba ikuelang teng kana ba swela mo teng. Banna ke batho ba ene gore they go through a lot and they don't have many people to talk to. So I think I just want to encourage batswana kwa nte gore one, let's stop discriminating our male partners when they're having some of these conditions. Gantsi we think they are cheating on us, and a lot of men will say, I've got way too much stress to be cheating on my partner, but she thinks I'm cheating. Come and talk to your healthcare professional about some of these problems, and we involve you, because now we're talking about I get we hear this word and it involves a lot of that. We have a men's clinic, Tebelopele. This men's clinic is still new, but we're growing every day by coming to places like this and telling you about us. We're also opening up another men's clinic ko Molepolole. So I think end of July we'll be able to start seeing. We just recently hired our male nurse, so we're going to be seeing borre ko mo goditshane go akwa. They'll be able to come to Tebelopele. Mo Gaborone, Tebelopele a rona e ko main mall. Everybody knows where it is, but in case you don't know, Halebalen la GSS, the purple building on your right. Ko Molepolole mo tseleng hela e yang Scottish on your right. Tsela teng ya Molepolole one hela o tlo go e bona mo tseleng.
And lastly, how do you advise women who see that their partners have this problem? You know, gore mo rotloetsa yang gore a re tsamaye re ko men's clinic a re ko Tebelopele we tackle yang khanye ha o le mme o itemogela gore o ka tswa ala le that problem ha o la lene.
Kana relationships, they're about being open and being honest. I get that are some of the basic things of being in a relationship. I get how panosa khone go bua le partner ra gago itse re there's a problem. Now ha re tsenga mathata a tsa tlhakanelo dikobo, you should understand how sex is a two-way. It's not one person. And the two, as a woman, just like lo ena ona le phases. Go na le nako e letsang, go na le nako o sa eletseng, go na le nako o sa kgoneng. Monna le ene o ntse yalo. Makgwa ba re kana ke re boranyane bana le gore basadi bana le menopause, banna bana le andropause. Bana le mathata a tankanta teng ya go gola keletso e be ya kwa tlase. A ra amogeleng seemo se bo mme re batho ba re ang dipateleng a re reetse a re rotloetseng re kgothatse banna ba rona gore ba kgone gore ba te dipateleng ba ska ba tshaba.
Ngaka ke lebogile fela thata re tla kopana gape la bone yo tlang gone ha mo high voltage re lebogela fela thata ba Tebelopele Wellness Clinic moretsi ne ke la le jalo Dr. Botlhale Mosadime a tle go re bolella ka premature ejaculation. I wonder what we'll be talking about on our next episode. Thank you so much for coming through.
Thank you. It was such a pleasure. I really enjoyed being here.
Women talking men's issues. So interesting.
Be more aware of your health status, health conditions, and enjoy healthy living. Choose to know more and listen to Health Unpacked every Thursday at 5:35 p.m. on High Voltage. Your health, your wealth. Brought to you by Tebelopele Wellness Clinics.